To curb COVID-19 in BC have played a role in the rise of opioid deaths last month. The combination of being alone and tainted street drugs led to a record number of fatal overdoses. In May, about 5 people died on average every single day. CTV's BC Bureau Chief Nirmala Raniga on an epidemic in the middle of a pandemic.
Any overdoses this morning?
That question is always asked by frontline workers on Vancouver's downtown east side. And every day, the answer is yes. The number of fatal overdoses in BC is now greater than the total number of people who died from COVID-19.
It could be your father, mother, brother, sister. It touches everyone.
Nirmala Raniga runs several addiction treatment centers. Since the pandemic hit, some of her patients have died because they used drugs while in isolation.
We haven't seen a lot of COVID down here. The main thing down here in the downtown east side is people overdosing.
In the month of May alone, 170 people died of suspected overdoses. That's the highest number of illicit drug deaths ever recorded in a single month.
I cannot express how difficult this news has been to hear. My thoughts and condolences go out to the families and friends of those who have lost their loved ones, and I share your grief.
Toxic street drugs are a big part of the problem. Most are laced with extreme amounts of fentanyl and other contaminants.
We know that the drug supply in BC, even more than ever, is highly toxic.
Deaths are also on the rise in smaller cities and rural communities.
There's nobody watching them. There's nobody there to help.
Even though physical distancing rules remain, people are being encouraged to either use with others or at a safe consumption site. BC recently relaxed regulations, making it easier to get safer substances like methadone. But some doctors won't prescribe those drugs outside of a treatment program. Melanie Nagy, CTV News, Vancouver.